As more and more people are vaccinated and schools reopen for in-person learning, many parents are wondering about their children. We thank you for staying with us here at 5. I'm Dave Llewellyn.
One of the biggest questions amongst parents, many now starting to ask it, when will a vaccine be ready for our kids? And joining us now to answer that is our Chief Health Editor, Dr. Partha Nandi. Dr. Nandi, good Friday to you.
Hi, Glenda. How are you?
Fine, thank you. We hope you can update us on the latest regarding kids and COVID vaccines.
And Glenda, you know I'm a dad and a doctor, and so I keep a close eye on new developments concerning kids and vaccines, not only for my patients, but personally. And as of now, there's a possibility that we'll see vaccines for kids sometime in late summer or early September. So that's good news. And if it's a go, vaccines would likely only be available to a specific age group. And why? That's because Pfizer's clinical trial, Glenda, they enrolled just over 2,200 kids between the ages of 12 and 15. And in Moderna, the other company with the vaccine that we know, in their trial, they aim for 3,000 children between the ages of 12 and 17.
Okay, so when might we hear how these trials are doing, Dr. Nandi? And are the companies planning studies for kids younger than 12?
Yeah, so Glenda, Pfizer said that they expect to have results for the trials by summer, and Moderna expects their results to be around mid-year. Now, if all goes well, then I expect the companies would continue with what we call quote-unquote age de-escalation. So what the heck does that mean, right? That means that companies work backwards. So if they start testing with adults, as seen with the coronavirus, they would actually step carefully down through the age brackets, and researchers watch for side effects and make sure, right, this is super important, that vaccine is safe and produces a strong immune response before moving on to a younger age bracket.
All right, Dr. Nandi, so we know there are people, parents, leery of vaccines for kids, especially when they're considered to be at lower risk of developing a severe case of COVID-19. Tell us why kids should be immunized.
Yeah, I get it all the time. Whenever I post on social media, people are really petrified about it, and they shouldn't be. First of all, kids are less likely to get severely sick. I get that. But there have been at least 227 deaths, and roughly 2% of infected children have to be hospitalized. So it's not just about deaths, it's about getting hospitalized and sick. So if we have a vaccine for kids, Glenda, it would likely prevent severe disease as well as death. It would also do a few other things, right? Number one, it would help us get that herd immunity. Remember, we have to get at least, to me, 70 to 80% of the population to be immunized. Number two, it also helped kids in racial and ethnic populations that have been hit hardest by this infectious virus, the coronavirus. And number three, it would help the kids get back into school activities that are high risk for transmissions, like band practice, choir classes, so those kinds of things. Bottom line is that I think, if we can get kids to be immunized and be safer, it'd help us to normalize activities for them. My kids and everybody else's kids who's watching, they need to get back to normalcy, I think, for their physical and mental health.
But we're saying they will be the last group, right, to be considered at this point.
They will be, but it's coming around the corner. I'm talking about summer or late September, so it's not that far away, because we've been through this for a year now, right? Imagine it's already February, so it's not that long. We can hang on and we can get past this.
Time to start thinking about our kids. Thank you, Dr. Nandi. Hope you have a good Valentine's weekend, you and Callie. And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter, and we'll get it right to him.